Every clergyman has had this experience of getting a call, it's usually in the middle of the night, from a family, from a social worker in a hospital, from a friend of a friend of a friend, that a family's in crisis in a hospital. You get up, you kiss your wife goodbye, your spouse goodbye, you get dressed, you drive to the hospital, and what you discover is grandma, mom, dad, Uncle Fred, lying in an ICU room, attached to wires and tubes and a variety of medical interventions, and a family gathered around the bed. And the family is alternatively grieving and angry at each other, grieving and arguing. They're grieving because the doctors have told them there's nothing else they can do to preserve life. And they're angry at each other because they're being asked to make a decision that no loved one has ever been prepared to make, which is, when is it time to die? If we let mom go, there's the burden of you killed mom. And if we keep her on the feeding tube and put in the ventilator tube and continue the ordeal of preserving the life of the body, then there's the sense of I left mom suffer. It's an impossible situation.
So then there's the question about what do you do if these discussions have not taken place before serious illness and unconsciousness sets in. You've got a family there, they're distraught, they're upset, they're trying to make decisions. And absent or lacking any clear indication from the patient about what they would like, I think the key thing to remember is that decisions about the patient's care have to be made as close to the patient or from the patient's perspective as possible. When we try to make decisions about health care for somebody else, we're always trying to do it from their perspective. In other words, what would be best for them? And we can make that calculation of burdens and benefits for them just as they might do for themselves, even if we don't know too much about what they want.
One of the hardest times in family meetings is when someone is struggling with, but I can't do that to him. I can't make that decision to end his life. And then it's our job to say, you're not making that decision. Your loved one is unable to speak to us right now. And what we need you to do is think about if your spouse were to walk in the room right this minute and say, this is what I want to do, what would that answer be? And so you have to think not as you would want done, because of course you're going to miss your loved one and you don't want them to go. But if they could say what they wanted done, what would that be?
So sometimes we see that family members forget to consider what the patient would want in terms of these are things that are happening to the patient's body and the patient's quality of life. And family members consciously or subconsciously are trying to hold on to things that they want as a family member, as they would normally want, right? You don't want to lose your loved one. You don't want someone that you care about to die or not get every single possible treatment. But that's not always necessarily what the patients want. And reminding families about that sometimes can be challenging. So it's sort of gently reminding people that we need to think about the other perspective, the patient laying in the bed who may not be able to represent their own wishes. And I usually like to do that by pulling back and just saying, tell me a little bit about your dad or your mom and what kinds of things did they like to do and what sorts of things did they find meaningful and what matters most to them. And then talking about what the patient enjoyed and then putting that in context of what it will look like or what it probably will look like for 6 months from now if we continue on this path of most aggressive measures, that those things that that patient enjoyed and valued most in life are going to be gone. And then we can start having the conversation of, do you think mom would find life worth living in that situation? And sometimes when you reframe it like that and put it in context, people think about it and go, you know, you're right. Like she's not gonna go back to the beach and look at the ocean. It's not gonna happen.